Hello class, today's topic is types of disorders in circulatory system. So let's get started one by one without wasting any time. The first disorder is high blood pressure. Now, what is high blood pressure? Well, it is a pressure which is created by the blood flow on the walls of the blood vessels itself. In humans, the normal range of blood pressure is 120/80. 120 is systolic blood pressure and 80 is diastolic blood pressure. The question is, what is systolic blood pressure and diastolic blood pressure? The systolic blood pressure means the pressure created in the arteries when the blood flows through the arteries to the rest of the body when the heart beats. Diastolic blood pressure, on the other hand, is the blood pressure created in the arteries when the heart relaxes between the beats. So, if the normal high blood pressure is higher than 140/90, this situation is called hypertension. Hypertension has no signs and symptoms. Hypertension may lead to heart diseases, improper functionality of the brains and the kidneys, etc. High blood pressure may be caused by the following factors. Factors such as intake of salt food, as well as intake of a lot of alcohols, such as beer, and intake of large amount of fats and lipids in our bodies. So this is all about high blood pressure. The second disease is coronary artery disease. Coronary artery disease is a disease which is caused by the deposition of wax and cholesterol in the blood vessels, which supplies to the heart muscles, and this deposition leads to the blockage of the blood flow. So examples of the foods that you may avoid to eat in large quantities are the foods that contain high levels of cholesterol and waxes and fats, such as meat and eggs. High intake may lead to heart attack. So if there is a blockage, there is no blood passes to the heart. So it may lead to heart attack. So coronary artery may be caused by the following factors, such as smoking, high blood pressure, high cholesterol, and diabetes. So if you are diabetic and you're not taking insulin, it may lead to heart attack. Now, the third disease is angina. Angina is the condition, or rather the chest pain condition, which is exhibited by the insufficient supply of nutrients as well as oxygen to the heart. It is induced by the following factors, such as smoking, age factor, more than 48 years old, hypertension, and obesity. It is about taking a lot of fat foods. The fifth one is the extreme cost of physical inactivity. Last one is heart failure. So, heart failure may be defined as the chronic condition where the heart doesn't pump sufficient blood to the body tissues as well as cells in the body. And the other name for the heart failure is congestive heart failure, because the main condition of the heart failure is the lung conditions. It may be caused by the following list: smoking, taking fat acids, food, obesity, and etc.